Let's talk about strokes. They are the same thing as CVAs, or cerebrovascular accidents. We're going to discuss how to recognize when someone is having a stroke and what to do about it. The symptoms of a stroke are almost always sudden onset events. It might be a sudden numbness or weakness in the face, arm, or leg, usually on only one side of the body. It could also be a sudden confusion, sudden trouble speaking, or difficulty understanding words. It could be sudden trouble seeing in one or both eyes. It might be peripheral vision that goes, it might be one eye that goes, it might be both eyes. It's varied. It might be sudden trouble walking, or a sudden dizziness, or a sudden loss of balance, or a lack of coordination. It might be walking down a hall, bouncing off the wall. And it might just be the worst headache you've ever gotten in your life without any obvious cause. It'll be sudden onset. You could be walking across the floor and grab your head in pain. So what do? Well, first of all, you check the patient using the Cincinnati Pre-Hospital Stroke Scale. We'll show you how later. And then you're going to call 911 if the stroke scale was positive. In other words, the patient flunked. And you're going to call 911 if the stroke scale was negative, but you feel that something just isn't right. Or you're going to call 911 if you're just not sure. The ambulance sees a lot of strokes. Then you're going to write down the time at which the symptoms were first noted. And it's very important to write down the name and phone number of the person that last saw the patient in an okay condition, and what time that was. And what's at least as important as what you do is what you don't do. You don't let the patient eat or drink anything. And you don't give the patient an aspirin. You don't let the patient lie on their back unless you elevate the head about 15 degrees. It's an airway issue. You don't drive the patient to the hospital in a private vehicle. You don't cancel the drill if the symptoms suddenly disappear. And you don't delay for anything. Earlier in this segment, we said we would show you how to check the patient using the Cincinnati Pre-Hospital Stroke Scale. There's three parts. The first is facial droop. Have the patient look at you and try and smile broadly enough to show teeth. If, as on the left, there's nothing unusual, they were negative. If, however, if you look at the picture on the right, you'll see that one side of the mouth is drooping and the other side is not. That's flunking that test. That's a positive. The second part of this test is called arm drift. Have the patient close their eyes and then extend both arms straight out, palms up. The normal response is to be able to do it. If, however, one arm doesn't get up there at all or gets there and drifts away within 10 seconds, that's another positive on the scale. They flunked. The third leg on the stool is called abnormal speech. Have the person say, "You can't teach an old dog new tricks." If the patient is going to be negative on this part of the test, they're going to have to say it back to you the way you said it to them. An abnormal response that would cause them to flunk is if they slur the words, such as, "We can't teach an old dog new tricks," or they get the words in the wrong order or use the wrong words. It might be, "Can't dog trick teach car." If the patient flunks any one of these three tests, the patient is Cincinnati positive, and there is a 72% chance that the patient is having a stroke. It's entirely possible that the patient is Cincinnati negative and is still having a stroke. Err on the side of caution. Dead brain tissue stays dead. Call for an ambulance. So that's how you check for a stroke or a CVA and what you do about it. I cannot overemphasize the importance of getting this straight. Stroke is the fourth largest killer in this country and the largest disabler by far. The greatest enemy to recovery from a stroke is delay. Every second counts.